preventing, arresting, and reversing. These are the main ideas of the book. The book revolves around these three main ideas: preventing, arresting, reversing. According to Dr. Greger, he said that most deaths in America and other countries are preventable because they are related to what we eat. Diet is the number one cause of premature death. Diet is the number one cause of disability. Surely diet must also be the number one thing taught in medical schools. Doctor says he recommends that we should all be eating fruits and vegetables as if our lives depend on it, because they do. Key terminologies. Terminology is actually the method of collecting words and terms and putting them into specialized dictionaries. Heart disease, bypass surgery, CABG, which is coronary artery bypass graft, which means a surgery performed by the surgeon in order to take a vein from somewhere like an artery or a vein from the thigh or from the leg and sew it or stitch it to the damaged area in the heart. And chronic disease, which is a disorder or a disease that develops and persists over a long period of time. And clinical nutrition, which is the use of diet and supplements to treat the disease, to prevent the disease. From worse to better. This is Frances Greger, the mother of Dr. Greger. Dr. Greger, when he was a kid, he was growing up watching his grandmother suffering from pain, suffering from claudication, angina, and she had had so many bypass surgeries that the surgeons ran out of plumbing the scarring from each open heart surgery, which made the next more difficult. So the doctor sent her home to die. They lost hope because there was nothing else they could do. She was 65 and she was in desperation. And then she heard of a guy named Nathan Pritikin, one of the early lifestyle medicine pioneers, specialized in clinical nutrition in reversing terminal heart disease. And she arrived in a wheelchair, and then she was put on a plant-based diet, whole plant-based diet. And within 3 weeks, she was not only out of her wheelchair, but she was able to walk 10 miles a day. Thanks to a healthy diet, she was able to enjoy another 31 years. Methodology, translation, procedures and techniques. I was working on these different techniques and strategies using translation dictionaries, websites, monolingual and bilingual dictionaries, language, translation context. And specialized technical dictionaries are useful for technical translators since they provide them with a substantial source of words, of synonyms and abbreviations. Translators depend on technical dictionaries a lot. But good translators have to expand their knowledge by reading, asking specialists, using encyclopedias, and consulting electronic dictionaries. The role of medical translation to the health sector. The medical sector now is in a constant development. We are so lucky to be living in a modern world where technology and science are at a higher level of progress. The biggest challenge nowadays is in a global system is work environment and the global economy. The task of the translator, the challenge or the job of the translator is to try to develop a way or try to acquire the ability to understand and adapt to the work environment on one hand and to the global economy. And he cannot do this unless he breaks the language barriers and acquire technical skills, and then combines these technical skills with his language abilities. In other words, if we manage to combine all these different skills, we will absolutely find a way to connect the dots between establishing a very solid medical institution based on a comprehensive framework for providing a healthy public health care and ensuring highly sophisticated model of communication compatible for all different contexts. In other words, the updating of medical sector is impossible with these facilitators, namely business partners, professional translators, decision makers. Last but not least, translation is a precious tool of growth and understanding. So does language. Because language is the mother, language is the genesis, language is the source. Language is a vehicle for social change, social mobilization, social reconstruction, and national development. So we should protect translation from disinformation, from these enemies like disinformation, like manipulation, like distortion, like influence peddling, conflict of interest, and other malignant practices. If all medical translators gather and work under a transformative collaboration system, I think the medical sector will get better. As long as we have specialized translators willing and ready to cooperate and participate with their knowledge and experience in the development and building of social, economic, academic, medical institutions, it will be easier for the managers, the heads, the responsibles, the leaders to have access, to have this incredible opportunity to have access to the latest information in terms of technology, medicine, law, etc. But to be able to accomplish this huge task, we need to acknowledge and correct certain problems, like differences in scientific terminology, deceptive lexical equivalence, misconceived leadership level, autofocus translator training, misjudged translation expectation. We need to bridge the gap between medical information, medical knowledge, and practical healthcare. So using medical translation as a way to pave the way for a practical healthcare, in my opinion, will create a paradigm shift from a very fragile, corrupt, flawed healthcare system to a practical, to a robust, life-transforming, life-changing, life-saving, practical healthcare. Around 2,500 years ago, Hippocrates said, "Let food be thy medicine, and medicine be thy food." There is a secret in medicine, which is the best kept secret in medicine, is that if we give our bodies a chance, if we give our body the right conditions, our bodies can start healing themselves naturally without using drugs or surgeries or prescription pills. Thank you so much.
Thank you, Taya, for this presentation. Now, the floor is Zelen's.
Okay, thank you, Dr. Adel. Thank you, Khaled. I would like first to welcome your friends from Mauritania, and I would like to thank you, and at the same time to congratulate you because you managed it to the country of many other students to finish in, let's say, in due time. Okay, he didn't spend much time. وسمحنا the same, we are talking in English, but we'll come back to you in Arabic. Okay, so for Khaled, he managed to finish in due time, and I do really congratulate you for this. For the quality of the work, then I would like to shed light on his. He was really disciplined. I mean, respecting deadlines, our meetings, and everything. So again, that was very important to me because I want students who are committed. Then I think the importance of translation is that it should serve a purpose because professional translation at the University of Manouba, faculty of Manouba, is meant to help institutions, organizations, individuals, and so on to benefit from literature which is published all over the world. And when a student goes into this venture, which in my opinion is a bit hard to tackle even when we met, that was face to face. I mean, we didn't have much time to a presentation or something. So I really like your fluency.
Focus was on terminology, not on fluent speech.
So, but again, Khaled, you did not address the difficulties you faced with translation. That should be included in your presentation. Maybe the teacher would ask you later on about this issue. Okay? Thank you.
Okay, thank you. Then I'll move to Bassem Madloui.
شكرا سيد الرئيس. أود في البداية أشكر صديقي الأستاذ الشاوي الذي أتاح لنا فرصة مناقشة